The particular data doctors announced is also very much reasonable about the past, present, and future of the infection by different bacteria. So to control infection, there are a lot of research are also going on. So out of all those research, some researches are not so much applicable, but others are very much important nowadays. So to control infection, many branches of research are more important nowadays. So the branches we have studied and feel its importance for the futures of the medical science. Thank you all. You please continue.
So I would like to discuss upon the topic of the article, which is Principles of Surgical Audit. The surgical audit is a surveillance method where we can assess the quality of the treatment which is being provided by the hospital. And there is a similarity between audit and research, where research frames the background for the audit. Audit are of two types. One is prospective and one is retrospective. So what is retrospective? It is collection of the data of the past, and prospective, what are we going to do in the future, and currently that is prospective. So it is like type of surgery, the length of the stay, and the infection type. So we must rely specifically on the prospective data, as it gives a valuable information about the possible infections, possible length of the stay. And the second thing is that the surgical audit saves both time and money.
Thank you, Dr. Mishra and Dr. Bhagyashree. Now, it's a great point which they have taken into consideration is the how to do a infection control practice and reduce the morbidity and mortality in medical science in a low middle income country or a low resource setting countries and all. So audit is the only way in which we can prevent the spread of infection, the incidence of infection, and also the complications. Now, for understanding the audit, we should have a protocol which is should be a gold standard. Now, lately also we have learned that there are two types of research: prospective research and retrospective research. In those type of research, we are sure that yes, we are going to observe the data. But when it comes down to a proper gold standard, we can take intervention into account also. So our job is to completely assimilate all the results of the research under proper category and frame a number in a meta form or a meta analysis way. As a result of which, we'll be able to understand, are we really reducing the means of surgical site infection by a certain percentage, certain number, certain degree, and certain way? That should be a research question. And in surgical audit, it really helps us to control infection. Once we control infection by surgical audit, we are successful. And if surgical audit is taken into consideration, the various points like research and development, training of staff, calibration, and a lot of back examinations in terms of awareness, knowledge, and attitude, they take into picture. So it is very important for us to understand what is exactly surgical audit to control the surgical site infection and later also spread into the community level also. Thank you so much.